and that type of thing on our brain. Today, we're going to talk about something that I just think we just kind of forget about it, or we only deal with it after it's happened,
Yeah.
and that's brain trauma
Yeah.
or injury, right?
Even those people who suffer brain trauma don't know that they are victims of brain trauma. That's the unfortunate part of it.
So I know
And-
today
and-
you're going to take us into that a little deeper into that whole process.
Yes, I would like to talk about traumatic brain injury as a category first, and recently, just one thing just really bothered me quite a bit, because I have an idol. My idol was Linda Ruzi. Okay, she's a mixed martial artist
Okay.
who beat all of her opponents within 1 minute when she started the career. I mean, she was moving up so fast in the mixed martial art world, and she was knocked out by one kick in Australia. That was her first loss. One kick, just one kick. And since then, she lost every single fight. Wow. And she by then already made 2 or 3 million, I think, by the records. And she didn't know that. Today, she didn't know. She trained and trained, recently trained to, the most recent fight, she fought a boxer from South America, and she lost it in 45 seconds.
Oh my goodness.
Boom, it was over. I mean, people were saying, why, where is the Linda we used to see?
Yeah.
I was sitting there, I said, oh my God, she hasn't seen a doctor. What she should have done is, after the knockout in Australia, go to have the spec test, go to have the PET scan, the brain imaging tests.
Right.
Diagnosed it. Yes, you survive it all right, but X-ray, CAT scan show no problem. But the SPEC scan and the PET show you have brain damage. Treat it. If you don't treat it, no matter how hard you train, and she trained for a whole year to come back to this second another match with she thought was a comeback for the South American boxer. In 45 seconds, she was knocked down. She was knocked down. Because the brain doesn't have the reaction, the perception, everything that's necessary to have a win. And I doubt even she have the knockout power, and she cannot develop that knockout power because the motor strip is involved in a traumatic brain injury. So this is the most recent story that I feel so sad about, that I think people should know about post-traumatic brain injury. And then I wanted ex-football players, retired football players, if you start having symptoms like calculation, thoughts, smelling, hallucination, doing our tests and failed, and you were the ex-football player, you got a lot of money, okay? And NFL pays for it. So go to the test and call up NFL and have them.
There's no reason not to do
There's
it.
not to. Your insurance will pay for that. There's no reason for you not to have your CTE, chronic traumatic encephalopathy, which they give it only to the American football players. There's no reason why you cannot get that cure. It's curable, but you have to know that you got it. And so, as a ex-football player, or even the present football player, in fact, if I were a football player, I'm a SC, I'm a Trojan. Okay, I went to, I'm a Trojan, and I went to college at SC, and I love SC football. So if I were a quarterback, and I get knocked out all the time, I would do it annually.
So not every time you get knocked down, but
no,
at least once
I
a
would
week,
do
once
my
a year.
SPET scan, which is harmless.
Okay.
I would do my PET scan, which is harmless. I would do my MRI every year. In college, and once I'm into the professional football, I would do it every year. I'm paying millions. What is this test? This test is nothing.
Yeah.
So I would do the test to find out and document that I don't have the problem. I don't have the problem. And once I have the problem, I fix it.
Yeah.
And I can have my career longer. You've seen some of these quarterbacks and football players, they have 20, 30-year career, and you see some of them, 2, 3 years, they're gone.
Yeah.
They lost their their accuracy, or in the case of a quarterback, the accuracy and the distance and all of that. Why? What? How did you lose it? CTE.
Could be traced back to
Yeah.
those times where they got knocked
Yeah.
down and hit hard.
Yeah, you can make millions. What is treatment? It's thousands only. Maximum a test is about $1,000. $3,000 you have yourself diagnosed, and then you spend a few more $1,000 reversing it. You can make millions more over a long time. You can have your career longer. So I really want to get this across to, of course, I'm talking about football players. It's too obvious. The mixed martial artists, too obvious. But anybody, you could be an engineer, you could be a doctor, you could be anybody, and you have had a brain injury, brain trauma. Go test it, and the awareness is getting more and more is coming up. But unfortunately, a lot of these veterans mistreated, coming back from war. They start getting into drugs, getting into suicidal. Do you know that several hundred, I don't forget, per year of American soldiers kill themselves?
Yeah.
And it was kept as a secret, national secret. They don't report that.
Yeah.
My sister is a professor at USC OBGYN, and she, one weekend out of each month, she had to donate to teach the residents at Los Angeles County USC Hospital. And she goes, so she OBGYN, they deliver middle of the night, so she goes there middle of the night. She saw truckloads of veterans.
Oh.
Newspaper cannot report it. It's national classified information. Truckloads of veterans coming in injured into the USC Medical Center for rehabilitation.
Wow.
So if the explosion enough to take your finger away, imagine the explosion to your head, the concussion to your head.
Wow.
You just didn't lose your finger or leg or arm. You have brain injury on top of that. So when you try to kill yourself, it is not you are crazy. It's a part of the injury. Suicide is part of the injury. Trauma, hallucination is. Breaking of a family relationship it is. Erratic thinking is. Temper, personality change. All of these are part of post-traumatic syndrome that you can fix. Once you fix it, you have a great family again. You have a great personality, a great life again. And your addictions are gone.
That's such a common statement of when so and so went off to war,
Yes.
and they came back, they were never the same.
Yes, the explosions.
Yeah,
They survived.
Yeah.
The bullets, they didn't get hit with bullets, but the concussion. Boom,
It's just-
boom, boom, going off.
just like getting hit across the line from a 300-pound lineman.
And even the rifle, they said the M16 rifle, the rifle itself, every time you fire, when you get boom, 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 that bullet going off, that concussion, there's evidence now showing that sound explosion can cause deafness and head concussion syndromes.
Amazing. So this is brain injury, traumatic brain
injury,
and CTE, which is specifically for the American football
players.
But you're
yes.
lumping them together
Lumping
because it's still injury to the brain.
Injury to the brain.
And one thing I want to point out here as you're watching this is one of those things that Dr. Chein said back in the very first episode of this. All of this, once it's measured and determined, can be reversed.
Yes, can be reversed.
So all of this, it's like, I jokingly said this, but now I'm thinking about it, is like, yeah, I've had plenty of bicycle accidents, and now I'm thinking, wow, nothing never talked about then until today.
Yes.
Right? Thank goodness like I said, I passed the balance test. I'm looking at these other tests. I can't wait to try and make sure I pass those. But those are things that when your kids are in Pop Warner football and they're 7, 10, I don't know how early they start. Amy, how old is your nephew? That's 6 years old. They're starting to bump heads at that age. And then they do that. By the time they do get, as you said, they were really good in college, went to pro, and all of a sudden it's like their talent dropped completely off.
Yeah.
It was that years and years and years of
Yeah.
just, right? Could have been.
Yeah.
So, and I don't think we ever think about testing that. This has been a series on your brain health and optimal brain health, because at the end of the day, let's face it, the last thing we want to do is be looking like Arnold Schwarzenegger, strong and in great shape, but our brain is gone, and all we do is we're looking out the window and we're seeing the ocean behind us, and we don't even know. We can't even relate to that, right? And we're having issues with our hands or feet or whatever, and because our brain, as you said, that's that mechanism that sends that message. It can't.
Yes. It can.
And we don't even know that we have
Yeah.
gangrene or we have this, that, and the other. I don't think we want that.
Yeah.
So take charge now.
Take charge, because you've got to take charge.
Here's the first step I want you to take. If you haven't done it, and you've been with us all 4 episodes, shame on you if you haven't done it. Pick up the phone right now.
Yeah.
Call Jordan.
Yes.
Jordan will give you these tests. These are 3 simple tests to determine, hey, is there anything going on with my brain?
Yeah.
The balance test, the MOCA test, the reverse numbers test,
Yes.
the five words in 5 minutes test. If you have trouble with those,
Yes.
call, now take action. At least you
Yeah.
have something to say, well, it wasn't just, this one rare thing.
And I guarantee you it's not drug. You will not be prescribed a drug.
Yeah.
Guarantee you.
Should they, when they call Jordan and they test out and if for some reason have issues, can they get a hold of you? I mean, can you
Sure.
treat these things?
Sure.
All right.
I mean, I put it out right now. Mark Gordon in Ventura, he's the guru on post-traumatic brain injury. Go to Dr. Mark Gordon, okay? But if his appointment book is next year, you might want to choose me.
Yeah.
Again, if you got Alzheimer's dementia, Dr. Dale Bredesen, UCLA. He's the guru.
And no drugs.
No drugs. Go to the guru.
Yeah.
But if the guru's appointment is next year, you don't want to wait. Maybe you want to try me. Start first, finding out the causes.
Because this is all about, let's face it, your facility is called Palm Springs Life Extension Institute. The part that I like about this institute is, to me, it always says, "Hey, you're always learning." I
Yeah.
mean, you were at a major conference on the brain. You do this many times a year, and you're always learning. So
how can a person? What is the meaning of extending their life if they have Alzheimer's?
Totally.
You be eating dog food when you're in a nursing home. Your ass be wiped by somebody else. You don't even know when you pee and poo. You cannot control yourself. What is the quality of living? Why do you want to extend your life?
Yeah. Stop it now.
So that is why I'm involved. I'm involved because I don't want that to happen. The life extension had to do with quality, and it's the quality that's important in life extension.
Yeah.
That's why I'm involved.
Take action now. Call Dr. Chen's office and ask for Jordan. The number's on the screen. And take control, because this is not something that you have to, if you go into your normal doctor and they do a yearly physical, this is never going to come up, gang. You're never going to say, well, before you leave, I want you to take the MOCA test. Not going to happen, right? They're not going to play the backward number game with you. It's just not going to happen, right? So this is one of those things that you have to do the self-discovery. You can do this every year.
Yeah.
And, and share, please share it with friends, neighbors, loved
Absolutely
ones.
share with your friends, relatives, and loved ones.
Yeah.
Because they don't know. Forgive them. I feel like a preacher.
Yeah.
Forgive them, please.
Yeah.
Do not blame them. And I recently had an executive, very wealthy executive, sending his girlfriend to me. And his girlfriend was a beautiful girl, nice girl, but crazy on marijuana, getting drunk all the time, and irrational, up and down, and throwing things all over her home. Is a mess, But he loved her, okay? So he says, I think there's something wrong, Dr. Chen, check her out. So all I was question, did you have a brain injury? Yes. When? 17. What kind of injury? The car was totaled. And how many days was in the hospital? 5 days. How do you know 5 days? Because I woke up in 5 days. I was unconscious for 5 days. Wow. That is brain injury.
Yeah.
So lucky he's got the money for PET scan and spec test and document, prove it. Now she's on treatment and it's getting better.
Excellent.
And so here is just even a friend, a boyfriend caring about her saved her because she was total mess with the family. Family doesn't want her. Parents disown her. Do not want her to step in the because she's crazy. She smokes all day long, and then she has terrible relationships because of traumatic injury. Wow. Yeah.
Well, Dr. Chen, thank you so much, and this has been amazing. And go back and look at these, 1 through 4 if you haven't done already, and make sure to join us every week on the program. It's called Your Optimum Health. Dr. Chen is always sharing information to help you not only look better, but feel better from the inside out. And that does not preclude making sure your brain is at its optimum health. Dr. Chein, thank you so much.
You're welcome.
And thanks for joining us. This is called Your Optimum Health. I'm Jeff Harrison.
Dr. Edmund Chein.
See you next time.